Good afternoon, everyone, and welcome to this webinar hosted by the International Longevity Centre UK and the ILC Europe Network, titled Healthy Aging and Prevention in Europe, How Do European Countries Compare? My name is Patrick Swain, and I work as the Research and Development Manager here at the ILC UK, and I help to coordinate the activities of the ILC Europe Network. I'm just changing slides, bear with us, thank you. So, a little bit of context about who we are for those who are new. The ILC UK is the UK's leading authority on ageing and its impact on society. We're a member of the ILC Global Alliance, which is a network of 16 organisations dotted around the world, as you can see on the map here. And we are focused on addressing longevity and population ageing in productive and positive ways. The ILC Europe Network was established in December 2021 to address population ageing in Europe. And whilst it's not an individual ILC member, it is a loose network of organisations and individuals, academics and other people based in Europe focused on addressing these issues. So the ILC UK was a founding member. And we're proud to say that the network now has over 80 individual members from across 30 organisations spanning 18 European countries. So today we are joined by an expert panel of speakers, 2 here in the office and then 5 online, where we will be discussing the topic of healthy ageing and prevention in Europe using our prevention index, which was launched earlier this year at the World Health Assembly in Geneva. We will then hear reflections at the end of the presentations, followed by a Q&A. But before we get started, just some housekeeping rules to go through. So internet issues may affect sound and video, so please do bear with us if that does occur. And at the bottom of your screen, you will see you'll be able to communicate and put in the chat function any questions, or use the Q&A function to ask any questions or to chat amongst other attendees. And in the interest of time, we'd appreciate if you could keep your questions short and sweet, as we only have an hour and 15 minutes running time today. And if you are having issues with your audio or video, do try and connect through an Ethernet cable. And if you are disconnected, you can join again using the same link. We are quite active online on X, formerly known as Twitter. So please do get involved by using #PreventionIndex and tagging at ILC UK and at ILC_Europe. And this webinar will be recorded for public access and published online along with the slides the next day. Like I say, do get involved and post your comments online and get involved using the #PreventionIndex. But without further ado, if we now go to our first speaker, Arunima Himawan, who is sat next to me here. So Arun joined the ILC in March 2019 as a research fellow. She now works as the senior health research lead here and managing the ILC UK's prevention program, and has worked on a range of other topics, including medical adherence to structural heart disease and adult immunisation. She is a member of the Structural Heart Disease Coalition, where she actually was last night in Brussels talking about structural heart disease. And she's also on the ILC Global Alliance Long-Term Care Working Group and the Gender and Ageing Committee. In addition to global health, her interests include generational discourse, social inequalities, and financial well-being. Arun, without further ado, over to you.
Fantastic. Thanks. Thank you, Patrick. And good afternoon, everyone. I'm really delighted to be here. As Patrick mentioned, I will be very briefly running through our Healthy Aging and Prevention Index, which we launched earlier this year alongside the World Health Assembly. So our Healthy Aging and Prevention Index is a global index that ranks 121 countries on 6 healthy aging metrics. This includes lifespan, health span, work span, income, environmental performance, and happiness. Lifespan and health span are well-known metrics, life expectancy and healthy life expectancy. Work span is a metric that we calculated, which essentially looks at the average number of years a person can expect to be in work between the ages of 15 and 65. Income is measured as per capita GDP, Environmental performance is measured on a scale of 0 to 100 using the Yale Performance Index. And we also look at happiness, which is taken from the annual Gallup World Poll that scores countries on a scale of 0 to 10. So why did we look at these 6 metrics in particular? Well, we believe that these are fundamental to understanding the extent to which countries are investing in practices that support healthy aging and healthier and longer lives. In addition to ranking countries, individual countries, we also rank political groups and economic blocs, which is just another way for us to encourage governments to invest in healthy aging practices. Fantastic. So what you can see in front of you is our 9 political and economic blocs that we have currently ranked. And we can see that the European Union actually does quite well. It ranks in the 3rd position. It ranks for life and health span, both in the number 2 spot, including environmental performance. However, it ranks 3rd for income and happiness. Of course, you can probably see the big red block right in the middle there. Pretty difficult to look beyond that. That is work span. The EU currently ranks last place, 9th place for work span, which could be contributing to the region's ongoing skills shortages. But what we can see is clearly the EU does do well, but what I would like to do is also delve a little bit down into the actual region and see what's going on there as well. So these are the top 50 countries on the index, and 64% are in the WHO Europe region. We actually have all EU countries except for Bulgaria, which ranks 56th. So the EU does, relatively well. It ranks high up on the index, and this is definitely something that should be celebrated. However, there are still inequalities across countries. Taking the first 3 metrics, we can see that there's an 8-year gap in lifespan or life expectancy between the best and worst performing country, and this is equivalent, an equivalent ranking of 4th versus 57th on our index. There's a 6-year gap in health span between the best and worst performing country, and this is equivalent of ranking 5th versus 53rd on the index. And then finally, we see a 7-year gap in work span between the best and worst performing, and this is equivalent of ranking 39th or versus 97th on the index. So quite a large range here that we are seeing. So we did a little bit of analysis here. First looking at life expectancy and looking between East and West Europe. So what we find is life expectancy is lower in East Europe than it is in West Europe. And we can see sort of the top performing country being Sweden and the poorest performing country being Bulgaria. But what we can also see is generally across Western Europe, life expectancy is relatively stable. But when we look at Eastern Europe, we actually see a decline here. We've also included the UK and Israel there for context as well. The UK ranks 16th on our index and Israel ranks 13th on our index, so slightly better than the UK. But what we can see is that there is certainly this divide between the 2 regions. When we look at non-communicable diseases, and I think this is quite interesting. Again, we see a similar trend where Western Europe is relatively stable, but then we see an increase in deaths from NCDs for Eastern Europe, which almost mirrors the life expectancy chart that you just saw on the previous slide. NCDs cause about 90% of all deaths in Europe. So there's a lot that we can be doing to reduce and tackle non-communicable diseases. And Patrick mentioned yesterday I was at European Parliament talking about cardiovascular diseases and structural heart disease as being one of the health issues that are contributing to the burden of disease that we're seeing across the region. So what can we be doing? One thing is investing in prevention. And what we can see here is actually countries that perform well in the index spend quite a lot on prevention, especially those in the top 20. We can also be investing in immunization. Now, the immunization spend per capita is significantly lower than the prevention spend. However, again, we can see a trend where countries that perform better also spend more on immunization. However, I think we would certainly call for a greater spend on immunization. But these are just a few sort of initial thoughts that I thought I could leave the panel with, and of course the audience. And I'm happy to take any further questions during the Q&A. But thank you for listening, and I look forward to hearing everyone else's contributions.
Thank you very much. That was really interesting. I think, as you can see, there's a wide breadth of sort of information on our index that really dives deep into not only into those 6 metrics, but looking very holistically at healthy aging and prevention across Europe. So thank you so much for that, Aaron. That was fantastic. Next up, we have Dr. Daniela Weber joining us from the International Institute of Applied Systems Analysis. Dr. Daniela Weber is a distinguished interdisciplinary researcher specializing in health and aging. She holds a position as an assistant professor at the Vienna University of Economics and Business within the Health Economics Group, and at the International Institute for Applied Systems Analysis within the Population and Just Societies Group. Her work on contextual factors associated with equality and healthy aging underscores her commitment to advancing knowledge in this critical area. Daniela, thank you so much for joining us. Over to you. Sorry, you're on mute still.
Sorry. Good afternoon, and thank you very much. I'm very honored to be here and to give you some insights on the ranking of Austria when it comes to the prevention index. Can you give me the next slide already, please? As you can see here, on the website of the Prevention Index, you can nicely visualize the ranking of the countries depending on the coloring. And you can see here Austria in the middle, kind of middle of the map in a light orange. So it's on rank 15 out of 121. And I want to give you a bit more details how this ranking is composed of. It's ranking pretty good or okay when it comes to income. It's 11. Environmental performance is rank of 6, and happiness 13. So we can live with that. When it comes to lifespan and health, it's already a bit worse. It's 21. So we have about 81 years to live at birth, 70 in good health, or 79 in good health. We know that there's a slight increase, but when it comes now to working span, we rank 64, which means we have about 30 years of economic activity to expect. Well, which is quite challenging, I would say. And that gives me already some, brings me already to the next slide. When it comes to the challenges of Austria, we have currently about a population size of about 9 million. We expect 9.3 million by 2050. And 2 million are expected to be age 65 and above in 2025. And about 2.9 million already in 2059. And thinking about this working lifespan, I have to say Austria is a bit behind when it comes to retirement ages. We have official retirement age for men at age 65, for women only 60, starting small increases now in January. But so given all these numbers, you might see the challenges we can face. We have increasing health expenditures, and at the same side, we also have some decline in vaccination rates. So when it comes to prevention, which is the most crucial part, I think, speaking about increasing in older age and healthy aging, for instance, the adult flu vaccination rates are very low in Austria. We have about 18% of the 65 population vaccinated. Which is just for comparison reason, in Europe, we have a rate of about 40% of the 65 population vaccinated with influenza, and Austria is 18. And they even, I mean, we do not have good data on that, but even a small decline here. So that's definitely a challenge where we have to do something. But on the other hand, we also have some opportunities to increase, to see it from the positive side. I show you here a small visualization or a graph of partial life expectancies, just to make it a bit more comparing with the dimensions of the prevention index. It's partial life expectancy between 60 and 70, which means the expected years at the age of 60 of the upcoming 10 years. And on the left-hand side, there are the women, on the right-hand side, men. And you see the time range from 2004 to 2018. We calculated the life expectancy is pretty at 10 years for the women, at the age 60 for the partial life expectancy, similar to men with a bit lower than women. So when it comes now to this healthy life expectancy, we distinguish between the official measure of healthy life expectancy, which is the blue line. There's a small decline. But looking, for instance, at cognitive life expectancy, so years expected to live with good cognition, we see an increase, which gives us some hope. Also, when it comes to his healthy life years. And looking at the working life expectancy, for men, we can already see a big increase actually in the working life expectancy, in the partial working life expectancy at age 60. And for women, a small increase, which is expected to continue, but with this very small pace, as I mentioned. So basically, working life expectancy is, I think, the opportunity where we can improve when it comes to our prevention, ranking of the prevention index, but also in general, in terms of prevention and healthy aging for the Austrian population.
Brilliant. Thank you so much, Daniela. That was a fascinating presentation. It's always good to see other data as well to compare to our index. So that's really lovely. Thank you so much. Okay, so moving on to our next speaker, I'm delighted to welcome Dr. Katerina Machacova, who's the director of the ILC-Czech Republic. Dr. Katerina has worked in the field of physical activity since 1999, graduating from the Faculty of Physical Education and Sport at Charles University in Prague. She began to explore the link between physical activity and longevity and completed a postgraduate degree in 2009. She's also completed an internship with the Institute of Gerontology at Wayne State University in Detroit, Michigan, studying the effects of physical activity and functional fitness in older persons. Since 2012, she has been a member of the team at the Center for Study on Longevity and Long-Term Care, or CELLO for short, at the Faculty of Humanities at Charles University. Dr. Katerina, it is lovely to have you here today. Over to you.
Thank you very much for the introduction and welcome everyone. I'm honored to share with you some of the issues associated with aging from the Czech Republic. I lived there, I worked there, and I was born there, and it's really honored to share with you everything I prepared. As the rest of the world, Czech population is getting older and older. At the moment, we have over 1/5 of the population over 65 years of age. And in 2030, it's going to be 1/3 of the population. And in 2050, 1/3 of the population, one third. So we do have some issues even now. And with the aging population, it's going to be more and more crucial to deal with them and take some actions. So we identified 3 main areas or topics that the Czech Republic is dealing with. And the first area is sustainability of health and social care and sustainability of its quality. The biggest issue in Czech Republic is that the social and healthcare systems are separated. 2 different ministries, 2 different administrations, which makes things very complicated because the aging is complex and we can't divide it between the two systems. So it's going to be very challenging, and I think we need to take some actions to make those two systems collaborate a little bit better or merge in one. We are dealing with some issues in long-term care systems that are sufficient right now, but it's getting, like not enough. And for the future, we need to improve long-term care. We are dealing with insufficient support for rehabilitation and aftercare. So helping people to go back home after some accident or anything, that's something that needs to be improved in Czech Republic. And we identified insufficient development of assistive technologies. So that's another area. Another context is sustainability of labor market, which in total in the prevention index, we ended up 29th out of the 121 countries. And in labor span or work span, I think it's called work span, we ended up 65th, which is just behind the Austria. And our average years, like work span, is 30.3 years. And the retirement age is quite low. It's about 65 years of age in men and a little bit lower in women. So we are making retirement age a little bit higher every year, slowly, but it's not very popular. And we are dealing some, as you can imagine. And third area is very important to me, and it's promotion of prevention and personal responsibility. Can I ask to turn next slide, please? Okay, so to my opinion, if we want to be able to provide good care to all of the people that will need it in later life or sooner, it doesn't really matter. We need to take our own responsibility to do everything we can, which is in our power, to behave, to try to be as healthy as possible. So it's our own personal responsibility, and I think it should be promoted. Next slide, please. Okay. Few things about our actions, what is going on right now in the Czech Republic. I divided it in two areas or two levels, which first one is political level. We do have a strategic framework for preparing for an aging society, and it's run by the Ministry of Labor and Social Affairs, and it started in 2021, and it's planned to follow into 2025. So it's in progress, and the framework is divided into 6 areas. First area is earnings. Second one is human rights. Third is education and employment. Fourth is health and care. And fifth is housing. And the second level is the personal level I've been talking about previously a little bit. And I think it's crucial to support the engagement of all the adults to participate in healthy aging actions, being active, behave, be active and take care of themselves. Next slide, please. And I selected few quite unique good practice that I would like to share with you. First is our scientific and consultancy center, which was already introduced, and it's Center of Expertise in Longevity and Long-Term Care. And its focuses on education, research, community outreach, and care as global. So we are trying to connect all the areas associated with aging and gerontology and geriatric in the Czech Republic and create a good scientific and consultancy workplace. And next slide, please. And then I choose few different activities that are going on in Czech Republic right now on a national level. So it's all across the Czech Republic. And first is called the Memory of the Nation, which is a very nice program that promotes respect and understanding to all the population. And the program is sharing stories of people that lived in the past century and went through different lifetimes during the World War or the communism era. So it's very interesting, and I think it promotes aging and connects the generation by understanding the older adults and respect them and understand them. Next slide, please. Another good practice is called I60, and it's online portal that provides all the information from different areas for all the adults. It's it's used by lots of people, and I think it's important to provide accessible information for all adults to be able to, to live actively and healthy. Next slide, please. Another activities that I choose is focus on active living and physical activity. This organization provides different physical activity programs, trips for all adults, and they have centers all across the Czech Republic. We do have lots of organizations providing activities for all the people, but this is global, like a national. So that's why I selected this one. And the last slide, or one of the last. Okay, this is the program that is very unique for Czech Republic, and it connects the generations, young and older, and it's called Grandma's and Grandpa Fairy Tale Reading Club. And you can imagine it works like that. Grandma or grandpa goes to the kindergarten and they read a fairy tale after the lunch before the nap time. So it's very popular. It's also, like all around the Czech Republic. And I think it's very nice to connect the two generations, the youngest and the oldest, and give the sense of, like being active in a society, which is very important for all the people to be the part of the society and be active. Okay, and the next one. And because we are getting closer to Christmas, this is quite unique program that is also, like nationwide, and it's called Santa's Grandchildren. And it's very popular every year, more and more. And when all the people or older person in a nursery home, resident or somewhere has a wish, they have a website and they can share the wishes, and like other people can see the wishes, and whoever can make the wish come true, they join together and make the wish to come true. And it starts in mid-November every year before Christmas. So basically every person from the Czech Republic has the opportunity to help particular old person to make his wish come true, which I think is very nice and very unique, and it can inspire other countries to do similar good practice that are very welcome in Czech Republic. I thank you for the attention, and I'll just add that the aging is not about them, it's about us, because when we are thinking about all the issues coming with aging population, we are talking about the time in 20-30 years from now, and it's gonna be us who's gonna be in that age. So that's what I really like to do, to talk about aging, like it's not about them, but it's about us. Thank you, and thank you for the opportunity, and I'm looking forward to next contributions.
Thank you very much, Katerina. It was really, really interesting, and it's lovely to hear those examples from the Czech Republic. Okay, so next up we have Sophie Schmitt, who is the Director General of Seniosphère Conseil. She is the founder of Seniosphère Conseil, which is a leading strategy organization in the seniors market. Since 2006, she has been the go-to expert for global corporations aiming to reach the 50+ demographic in sectors such as banking, insurance, retail, and franchising in both Europe and North America. Before launching Seniosphère, Sophie gained marketing experience at L'Oréal in France, served as a vice president for marketing at McDonald's in the Czech Republic and Slovakia, and played pivotal roles at Coca-Cola Brazil. Furthermore, she is a trusted member of the European Commission's DG Connect's digital projects focusing on the older population. Sophie, bonjour, welcome. Over to you.
Thank you. Hi, everyone. I'm really honored to be with you this afternoon. Well, can you pass the next slide, please? Yeah, next one. Yeah. Next slide. Yeah. Here is France's current situation according to the ILC Healthy Aging and Prevention Index. We are on 19th. We have a good score with life expectancy and health span, as you see. As my fellows who were talking before, we are behind in the work span, 34, which doesn't seem to be that bad as compared to the others. But with the retirement age of 62 and soon to be 64, we are trying to improve this score, although definitely this is a big challenge for France, as all the other countries we are aging quite quickly. Regarding income and environmental performance, there is no big issue. And in terms of happiness, this is a challenge for us, but I'm afraid we might not be able to improve it because French keep on grumbling a lot about their lot. And that's a big challenge. I think one of our biggest challenges. Well, regarding aging well, and I'm talking about aging well because unfortunately we don't have an expression for healthy aging in France. I want to share with you the result of an observatory which we have been running since 2008. So in France, Germany, and UK, in order to understand what aging well means and what do people do about aging well. So the first thing I wanted to share with you is that aging well is definitely a strong and growing expectation. And this expectation has increased since 2018, almost doubled, because the people who consider that aging well is very important increased from 39 to 60%. So this is a big issue. Next slide. But it's a big expectation that is somehow difficult to meet, because you see that only 1 in 6 persons considers that she's aging well. If you consider that only 9% have given a mark of 9 and 5 of 10. In average, we have a mark of 6.9. But what is very interesting is that we see that the lowest score were among the 50 to 59 who consider that they do not age well. And this is one of the challenges we have. Next slide, please. Then we ask the people what they consider, what does aging well mean? And first and foremost, aging well means to be in good health, because half of the people for their first answer choose this to be in good health. Next slide. But if you consider the 3 top answers, against to be in good health is the first, but the second answered are continue to be able to do what you enjoy in life and feel good about yourself. And what is interesting is that 10 years ago, feel good about yourself was much higher, reaching about 60%, and that now it has somehow decreased, and it's a more balanced between continue to be able to do what you enjoy in life and feel good about yourself. This means that this activity part is becoming more important. Next slide. In this observatory, we asked the people what is very important to age well. And what comes out in 2023 is that the first thing is something related to healthy living, like giving up smoking, sleep well, protecting skin from sun, and do regular physical activity. The second thing is feel good at home, something about your environment. And this is something which was first in 2022, which is definitely related to the experience people had at home during the COVID. The third priority is something related to socialization, seeing your children and grandchildren regularly, and regular contacts with friends. And the fourth one is food, having a balanced diet and varied food. What is interesting and what we see out of those results is that, in fact, aging well has become a global lifestyle, and that people need to combine a strategy related to healthy living, good environment, socialization, and food. And this is becoming more and more complex. And the people tell us that they need to be better advised about all those topics, because it's kind of complicated to just be able to do the best thing in all those dimensions. Regarding what is interesting, and I wanted to stress this point, is that aging well is not, as far as France is concerned, connected with the medical health. Because if you see at the bottom, we have consult a doctor regularly, have regular checkup, and take medication are one of the lowest scores. Next slide. I wanted to focus on one point because we were talking about the work span. Continue to work is in sharp decline since 2015 in terms of being very important. In 2015, 20% of the people considered that it was very important to keep on working to age well. And in 2023, we are only 7%. This means this is a very big challenge for ourselves. Next slide. And as a summary, what we can do is that aging well is really a growing concern and challenge for baby boomers. Growing concerns because they have been, it has been an expectation for a long time, but now as they are aging, reaching 80, they try their best, but they know that it's becoming difficult. And on the other end, it's a strong expectation for Generation X as they approach retirement. And we see that they tend to have a different strategy from the baby boomers. And what is interesting as well, it's really a common expectation among the over 50s in France, UK, and Germany, with quite many common approaches, but some really major differences to be considered. And this is where the challenges are as well, that it's difficult to have the same approach throughout all European countries. So this is what I wanted to share with you. If you have any question, it's a very quick introduction to this observatory. Please contact me. I'll be very happy to share it with you. And if you have any question, obviously, I'm here to answer your question. Thank you.
Merci beaucoup. That was excellent. Thank you so much, Sophie. I really appreciate that. I am now happy to move on to our next speaker, Professor Mark A. Clarfield. Mark is the president of ILC-Israel, and he is a geriatrician with special interest in older persons in low-income countries. He was the director of the Medical School for International Health at the Ben Gurion University and is an emeritus professor at the Faculty of Health Sciences there, as well as an adjunct professor at the McGill University in Canada. He is currently chair of the National Council of Geriatrics of the Ministry of Health in Israel. Mark, thank you very much for joining us today. The floor is yours.
Thank you very much, Patrick, and to ILC-UK, and to all of you. Good afternoon. I'll have the next slide, please. I'm going to try and show you how we compare, touch on a couple of the issues that have been already addressed. Next, please. I don't have any disclosures or conflicts of interest to declare. Next, please. Next slide.
Apologies.
Okay.
Yeah, thank you.
Yeah, so, you know, as you probably know, we're in the middle of a war right now, and I wondered whether Patrick still wanted me to present, but he said yes. So I'm going to comment as if there's no war going on, but clearly we can't ignore the situation. This is one of the kibbutzim on the Gaza border before the war. Next slide, please. So I'll talk about our ranking and index. I'll talk about the challenges we face and maybe some opportunities how we might improve our situation as was requested by the organizers. Next slide, please. First of all, chapeau, merci bien, and thank you very much to UK. I think you did a fantastic job with this index. It's so much fun to play with, not just for Israel, but looking around the other countries that I know. Our ranking is 13th, and I'll get to there, and we're not bad at all overall, but let's talk about where we can improve. Next slide, please. So here we are. The blue I'm not going to discuss because we've done pretty well in those. I will discuss briefly in 2 minutes, even less, each of the three where we haven't done so well. Next slide, please. So on income, on the positive side, the country had a growing economy before the war, mainly driven by high tech. Healthcare is free, so it doesn't cost patients very much. Most of our older patients are refugees, Holocaust survivors, and this will change, meaning that the education and condition of the people that are going to be old in the next 20 years will be better than those who are old now. We do have a late pension age, one of the latest in the world. That's 67 for men and 62 with women and rising. On the negative side, we're a small island country. Although we're not an island, we're surrounded by countries that don't want to have too much to do with us. And we don't have a large internal market. We have high taxes. For example, 4.5% of our GMP goes to defense, as you can imagine, which is the 10th highest in the world. We have a universal pension payment system, but it's low, and older people are not employed at the rate that we'd like them to be. Next, please. On the environmental side, there's a growing awareness. There's some recent legislation. We have a lot of sun here. We've made a huge investment in desalination over the past 10, 15 years, so that we used to be a dry, drought-ridden country, and now we don't worry about where our water is coming from. We do for farmers, but even there's extensive use of micro irrigation. So we seem to have pretty well solved that problem in a very dry, dusty part of the world. We're lucky that we discovered natural gas 10 years ago. We have a lot of solar power and some wind, and these are all growing. On the negative, it is a desert. Global warming affects us all, but it's going to be extremely bad in the Middle East, where we are. The country is crowded on the coast and the center, and unfortunately, we have a weak Ministry of Environment. It hasn't ever been able to muscle its way in beside the other more powerful ministries, and so they're always behind, although there is growing awareness. Next slide, please. On the work span, on the one hand, pension age is relatively high, as I said, 67 to 62, and soon for women it'll go up to 67 as well. But there is a cohort effect in that we have a low education attainment of the elderly people that are older today, although that will change as and high-tech economy attracts younger people. So the older people looking for work are at a disadvantage. We have special populations in this country. We have older immigrants that came from the former Soviet Union among the elderly. Arab Israelis are a growing number percentage-wise and absolutely. And we have ultra-Orthodox Jews who are also a special population. So it's not a homogeneous situation here, and we have to give special attention to various parts of the older persons in the country. Next slide, please. I said this was antebellum. This was last week. This is a kibbutz that was burned down by an invasion, and we're in the midst of trying to struggle with that. So I don't want to go into that too much detail, but you can imagine how old people are affected by this. Our older people have been traumatized by being Holocaust survivors, by running away from Arab countries, by being through wars that we've had to suffer in this country, and they're now suffering from another one. Despite that, they're extremely resilient. This morning I gave a talk, for example, at our local community center to the older age group and about 50 people came, and the subject was healthy aging. And I said, I know it sounds a bit crazy to be talking about healthy aging in the middle of the war, but we must look ahead and hope for better days. Next slide, please. If you're interested at all in any of the things going on right now, here are a couple of articles and links, which I guess will be shared in the slides, so you don't have to copy them down, but it'll give you a sense of how we're coping. In particular, I present these as issues relating to older persons, not the general situation. Next slide, please. Thank you very much. Toda raba, merci beaucoup, dankeschön, and I look forward to being part of the discussion. Thank you.
Thank you very much, Mark. We appreciate your time. Thank you. Okay, and last but not least, I'm pleased to welcome Radu Ganescu, who is the president of the Coalition of Patients Organizations with Chronic Diseases in Romania. Inspired to change an unwieldy healthcare system that offered few choices, Radu founded the Romanian Association of People with Major Thalassemia in 2004, together with other patients. And then in 2006, the association became a member of International Federation of Thalassemia, which helped to promote modern treatments options according to international guidelines. In 2008, the organization became a member of the National Alliance of Rare Diseases, and then in 2010, finally, it became the Romanian Coalition of Patient Organizations with Chronic Diseases, and since 2013, Radu has served as its president. Radu, thank you very much. The floor is yours.
Thank you very much for this invitation. Because I'm a patient and I'm not a specialist, I will just speak a little bit from Romanian system, and I try to give some details. I hope many of them will be useful for everyone that it is in this meeting. So first of all, looking at the ranking, sincerely, is not something that surprised me, because we talk about Romania, Eastern European countries that didn't invest very well in the past years in the health system or in prevention program or vaccination program. So we are quite, if you ask me, happy that we are not in the bottom of the list, because when we see statistics in the European level, we see Romania, Bulgaria, Greece somewhere at the end of the list, not in the beginning of the list. So indeed, there is a big difference between West European country and East European country. But what I want to point is that we also have a big difference inside the country, because if the health system is very different from country to country, inside the country there is a different of life expensive because of the health access care. Because when you talk about rural, it's another world. When you talk about urban, it's another world. So we have differences even between the region or between the different area in the country. As a big picture, because I saw a lot of data in different countries, I want to tell you that Romania has the same, let's say, the same road as other countries have. We have two systems, the social system and the health system, that are separated. And sometimes, because we discussed about the aging population, they didn't work together in order to fulfill the necessity of this group, but not only for elder aging population, also for population with disability or with different chronic disease. And we talk about population that started in 20 with 21 million people, and now we have 19.4 million people. So it's a decreasing in the population and increasing in aging. So as numbers, we started with 40%, 50% of population over 65, and now we have around 20% of population over 65. So this needs, in my opinion, and probably if we have a debate on that, this needs new policy regulation, new legislation, because we need to adapt to our needs. And our needs is that we have population increasing in age, and they need to have access to different programs. So I think one of the discussion is in this point is to have prevention programs, early detection of different kind of diseases, and of course vaccination. And this is me as a patient, and me as a patient representative, we try to solve here with the policymaker that these kind of programs are very effective. They cost less than a patient that has a already chronic disease, and we can prevent a lot of let's say diseases in especially in the vulnerable groups. And when we talk about vulnerable groups, we talk about people over 65, we talk about chronic patient, or worker in the health system, because also worker in the health system, I think it's one of the vulnerable groups. As I was saying before about these two differences inside the country, rural and area and urban, I must say that these 20% of people over 65, more than 45% of them are in the rural area. So in the rural area, it's a lack of accessibility for GPs, for example, or for drugstore, or even because of the economic level, or the possibility of the community or the family, they cannot go to a hospital in the urban area. They don't permit it, even they are insured, because there is a national health insurance that insure everyone that work, or everyone that is retired. So even if the health authorities have, let's say, accessible services for this population community, sometimes they cannot benefit of that because of the other factors, and one of that is the economic level. Another thing that I must say, when we discuss about let's say prevention, for us as the Romania population, as a country, something new, because many years before that, 10 years ago, 20 years ago, we didn't have this kind of programs. So we need, first of all, to educate, to have programs of awareness, of information, not only for the citizen, but also for the specialists, because it's something new. They are used to discuss with the patient in their offices, you know, this is the disease, this is the treatment, this is how we do it, and this is the way that we should work together. But they didn't discuss about other things, because not only a disease is something that the patient have. The patient must, let's say, have an advice from how, let's say, have a healthy life, how should eat, because I don't know, the situation or the problematics of the health, how should have, let's say, the exercise, because many of us, we don't think about a healthy life. We don't think about, I don't know, eating an apple per day, or go and exercise, or things like that. And sometimes we see that in the first ranking disease, we have cardiovascular disease, diabetics, and many other diseases that could be prevented, could be, let's say, avoided in the second part of the life. Because now, and I must say, as let's say, what I see day by day, we see more young people with 40, 45 that have this metabolistic disease, they have stroke, they have so many other arterial hypertension, things that normally we should see and we saw in the past at the people from over 65 or 70. So we can say now that this kind of disease that can be prevented, we have an impact even in the younger population. So indeed, we must have some crucial decision to see what is needed for a population that are, let's say, having this kind of crisis in prevention to implement and to do it. So as a patient, and I will stop, I don't want to take any longer, that should take. As a patient organization, we militate for this kind of programs that should be implemented in the health system, no matter what health system, because in the end of the day, for sure, we spend less and we increase life expectancy. And I think this is the conclusion.
Thank you so much, Radu. I appreciate that. And it's great to have a patient perspective, as always, on these discussions. And now in response to all of the panel discussions, and thank you to our panelists online who have given some excellent oversight today, and to Aaron as well for introducing the index. I'm very pleased to welcome Professor Norah Keating here in the office. Norah is a social gerontologist whose theoretical and empirical research has created evidence, challenged discourses, and influenced policy, social, and community contexts. She holds an academic appointments in Canada, the UK, and South Africa. Is a fellow of the Canadian Academy of Health Sciences, the Academy of Social Sciences in the UK, and the Gerontological Society of the US. And she is the chair of the board of directors at the Vanier Institute of the Family in Canada. Norah, what did you make of the conversations that have just been unfolded?
I think they were fascinating, and thank you all for your perspectives, for your passion about the work you're doing. What I'd like to do in a very short time, I know Patrick will cut me off if I take too long, is to start with the Healthy Aging and Prevention Index, and then comment a little bit on what I heard from each of you that sets out some of the particularities within your own country context, because I think those are fascinating. Aaron, I'd like to start with you. I was fortunate, as I look back now, to have a conversation about 10 years ago with John Beard, who was then the head of aging at the World Health Organization. And he told me about this radical report that he was writing, which was the World Report on Aging and Health. John is a physician. The radical part of it was that he saw healthy aging as the kind of fit between a person's health status and the settings in which they lived. And that was pretty radical, particularly for the World Health Organization. So what I see in this Healthy Aging Index is two things. One is that we see some of the physical metrics around lifespan and healthy lifespan, but then we see those important contexts: work, income, environment, and that big outcome that you measure by happiness on the index that we might call well-being. And I think those are fascinating. One of the things, if we have time, I might ask you to comment on is what are the outcomes that perhaps are more important at the country level, but where do we place the outcomes at individual levels? Because we heard about some of the individual differences among the countries here. So the diversity within a population, and how do we understand those? Averages are important, but so are the particularities within a country. Daniela, you raised a really important issue that I think comes through all of these presentations, and that is this whole measure of healthy life, not healthy life expectancy, excuse me, work span. And work span seems to be troubling to practically every one of you, because you do fine, and then there's this work span thing where we don't do so well. So my question for you, Daniela, is who benefits from a longer work span? This is a country level measure. You need to have workers. At the individual level, who benefits from being longer in the labor force? What about those countries where a lot of people never are in the formal labor force? So that one has always troubled me a bit. I'd love to hear from you. Katerina, I think one of the things you raised for me that's a really important one is the whole question about personal responsibility. And to what extent do we hold people responsible for being physically active, for being engaged? And I sense a little tension in your presentation, because you talk about You talked first about personal responsibility, and then you gave us all kinds of lovely examples of generational connections that are orchestrated to a certain extent, but help older people and younger people really be engaged and with each other. So that tension is interesting. Sophie, you made me smile when you said, we in France don't come out so well on happiness, but French people take pride, I'm paraphrasing, take pride in not being happy. So what that says to me is there really are country personalities that I think we need to take into account in these metrics. The other thing that you talked about that fits this theme about work span is that the interest in continuing to work is relatively low, and it seems, I think, as I recall, it's dropping. So what is that all about? Mark, you remind us about environment and how the physical environment of a place is so important. Living in a desert where, I mean, Israel, I know, has been a leader in irrigation systems for crops and making the most of limited water. But living in a place where climate change is going to have a huge impact, how do we think about that environment outcome? And will your country do well because it's gotten so good at things like drought and heat way before some of the rest of us have dealt with it? Radu, your presentation spoke to me about the real differences between countries. I think Romania probably has a higher proportion of older adults living in rural communities than many other countries in the world. You equate that with inequalities in terms of access to services, perhaps access to family members, and so on. So I'm really interested in your perspective on that part of how does a country do well if you've got inequalities within the country and the rural living is a big one. So I would say I'm going to leave it at that, Patrick. Really provocative and interesting presentations from all of you, and I'll look forward to your conversations and responses.
Thank you so much, and it's lovely to have you here today, all the way from Canada, so we do appreciate it. And yes, I think we've been gone over a little bit with our conversations in terms of time, so this will have to be a rapid fire Q&A. I know we've got a lot of questions which were asked before the webinar and some which have been asked online as well now. And there's one, I think, Mark, you might have replied to it, but one I found quite interesting, and it was about taxation, and healthcare has to be funded somehow via taxation if it allows redistribution. So I've seen recently in Kenya, I see President Ruto has just introduced a controversial sort of 2.5% tax to kind of fund a universal healthcare program. And I was talking to Aaron about this the other day, and I just want to hear from each of the panelists, yes or no, should we be paying more tax to fund universal healthcare? Aaron?
Yes.
Yes. Others, any other thoughts or comments from other speakers?
If I may say something, because it's also discussed here in Romania to increase taxes for health system. The idea is probably all of us will say yes, increase taxes for having a better system. But if we increase the taxes, we have a quality in the system, will increase the quality of the system, because sometimes people say we bring more money, but it's not enough. And even from our politician, we say, you know, the GDP for health increase from 4%, 6% is not enough, maybe 8 or 9%. But in the end of the day, the patient is happy about the health system, because if we look and ask in every country, do you want, probably many of them, they will say that they are not happy with the system. So we invest and have the same quality as long as we increase the taxes, because sometimes I don't think we do.
Thank you. Yes. No, I think, like I say, in the interest of time, we have a lot of questions here. So I'm just going to, there's one here I think is very interesting. Actually, we had a piece of work on alcohol and consumption of alcohol in older adults. And it says, I've heard that older people use quite a lot of alcohol. The question is why? Do older people in your respective countries drink a lot? Is there an issue with drinking and healthy aging in some countries?
I could answer that in a positive sense. We don't drink much in Israel. We drink a little bit. We're a Mediterranean country, and we drink wine with meals or not at all. And that's a culture, and Norah touched on this. There are huge cultural differences. I mean, young people here do not get drunk. There isn't drinking on the streets. There's only celebratory drinking and mild drinking, and that's a cultural thing. So I think we have to look at the different cultural reasons why things happen, sometimes good things like we don't drink much, or bad things like people smoke too much. So that's for the anthropologist and the social gerontologist, I think, to answer. Thank you.
Thank you very much. Do you know what? It's very hard when you have to chair these kind of things, because there's such brilliant questions here. I've got one here. So how do the panelists view their corresponding countries, a relation between the income capabilities and the older population and their health span? Aaron, I don't know if there's anything on the UK perhaps around income and kind of getting older, maybe?
So, I mean, I think, one of the things is, and I think also alluded to some of the other questions that were on here, but links into this one, is on the metrics that we use. Of course, the two economic ones being work span and income. And work span is limited in that we are looking at people between the ages of 15 and 65, and we are looking at those in the formal economy. So we do have a huge subset of the population that we're not looking at, and those over the age of 65 who are contributing both through formal contributions, but also informally. I would love to have a data set that looks at the informal contributions of older adults to really demonstrate the economic value of investing in prevention, because I think that's where we can also be looking at seeing, you know, what can we be doing to actually ensure that older adults are, you know, contributing to society in the way that they would like to contribute to society, to show that they do have value in society, because a lot of that is just going under the radar and hasn't properly been exposed.
Yeah, maybe Sophie, is there anything there in France? I know you mentioned in your presentation the decline from 2015 to now about people's desire to continue working, and that's what their belief that's what healthy aging is, or aging well. I was wondering, do you think there's a correlation there between maybe in France, maybe it's the low retirement age that plays a leading factor in that decline in interest to work in older age?
That's kind of complicated. I think one of the issues you raised about the revenue is important. Is that in France the average revenue of people who are retired is higher than the working people, and we are in France, we are the same thing in Italy as well, but we are very different from the other countries in that sense. And this is the reason why people do not consider that they should be keeping on working later. And I think this really helps a lot understand this decreasing score, because people consider that if they have enough money, they can enjoy life early in their 60s, then let's take it and have it enjoy.
That's a great answer. I've got a question here, and I wonder if Katerina maybe to come in on this. It's about with ever increase in diagnosis of dementia, facilitating promoting living well and dying well will be key aims globally. Katerina, I know you mentioned then about one of the pieces of good practice that was about older adults going into kindergartens and engaging with younger people and reading to them. And I was just wondering if there's anything there, maybe a focus on dementia prevention, or if there's any kind of ideas around that in the Czech Republic that might be related to this question at all.
Yes, we do have quite a lot of action, and now I'm thinking about it, that it's a shame that I didn't mention it, because we have huge Czech Alzheimer Association. And just a week ago, I was part of the big conference held in Prague, and it was focused just on the population with dementia and about the growing number of people suffering from dementia, not just the Alzheimer's disease, but different types. So yes, the attention is big, and we have lots of long-term care services providing the care for people with dementia, and it's a big issue because 30% that need care suffer from dementia. So, and they have specific needs, and it's really a big issue. And I think it would need more time to discuss it in a little bit deeper. But just in brief, we do have lots of activities and actions and attention on this topic.
Yeah, no, it's brilliant. That's a very high number as well, actually. And that's something I think people appreciate when we're looking at social care. So that's good to share. I've got one final question here on a comment about gender/sex specific issues in aging. And Daniela, I thought if I could bring you in, I know you mentioned, you showed the slides there, the difference between male and female in terms of healthy life expectancy and work life expectancy. Is there anything else maybe across Europe that you'd like to note, or any trends similar to that in Austria?
You mean with regard to the gender differences?
Yes, yes.
Well, overall, there's that women tend to live longer, but like men to a longer extent, like have healthier life, or from this remaining years. So, which is often then the question: is it because of these differences in working longer? I mean, men work longer. Is that this benefit of being healthy? And I think it's good to go away in Europe to increase the retirement ages, but keep it, because we know that working longer is beneficial for both, and it should be there should be the possibility for both genders to work longer. But on the other hand, we should also keep in mind that it's beneficial, yes, but some populations do not have the potential and the health potential to work longer. And here it comes again to the women. Sometimes we heard from Katerina about dementia and care provision. And I mean, these are most of the time women in Europe providing care for relatives, and it's informal care. So I think, in particular with gender differences, we need to focus a bit what makes the difference and what are different challenges, the genders as well as other groups like educational groups or whatever phases, and then talk about where we have potential to increase this measure or these possibilities. Yeah.
Brilliant. Well, I think that brings to close our Q&A, but I'm going to be cheeky and ask one final question to all the panelists. And just looking on my screen here, I'm going to go clockwise. So I'm going to start in the room. It's a very broad question, but keep it succinct answers. Aaron, how do we achieve healthier aging?
Oh. Well, I'll pick this loads. I think a lot going on in my mind right now. I'm thinking there's so many different things that we can do, but I think I'll just kind of follow one from the index, and that's having good up-to-date data that we can use to actually track progress over time. This is something you want to do with the index. We currently look at 2019 figures. I'm very keen to look at what's happening post-COVID. Without the data, we are unable to call for tangible change. We won't be able to put forward policy recommendations. So I think it's really important that we have that robust data set available for us to use and to inform policy.
Thank you. Norah, same question. How do we achieve healthy aging? In a very short one sentence.
Understand and address the inequalities within our countries.
Beautiful. Radu, how do we address healthy aging and improve it?
I think education and investing in health. We have prevention programs that have 0.002% of GDP. We cannot improve health with this kind of percentage.
Thank you. Sophie, how do we achieve healthy aging?
Same thing, I would say a lot of education. We could see with our observatory how the government campaign influenced the way people were considering aging well. And this is very interesting, this impact over the years.
Thank you. Mark, same question for you. How do we achieve healthy aging?
First of all, pick your parents carefully, but if you can't do that, start young. Let's look at for example, the obesity epidemic is going to wreak havoc in older people 20, 30, 40, 50 years from now. So we've got to start young with prevention and health promotion before people get old, so that they can so they can be healthy into old age.
Thank you. Daniela, how do we achieve healthy aging?
I would say reduce inequalities at a very early stage and raise the awareness of healthy aging and the importance of healthy aging.
Thank you. And Katerina, finally, how do we achieve healthy aging?
Sorry, I had to unmute. Surprisingly, I would say do whatever you can for yourself to be the inspiration and motivation for the others, and contribute as much as you can in the areas that are close to each of us.
Brilliant. Well, thank you so much to everyone who joined online, and to our speakers and to those in the office next to me too. I'm trying to get the slides to work. Technology fails me, but just the closing remarks from me. I think we've had a very interesting discussion today, and one that's been very fruitful. As you can see, that we've worked very hard on our index at the ILC-UK, and the ILC Europe Network continues to grow and to kind of spread this message at a European level about the importance of investing in health prevention and promoting healthy aging. I think, as Mark rightly said then, right across the life course, it's not just an older person's issue. It's something that we should be focusing on from the cradle right to the grave. So thank you for those who have joined us online. I think I just want to touch upon a couple of things. So we do have our Future of Aging conference, which is going to be taking place on the 7th of December. You can scan the QR code here. We're very technical here at ILC-UK, and you can get more information online if you go to futureofaging.org.uk. We also, before that, we do have our annual autumn reception on the 8th of November. So for more information, do head over to our events page on our website to find out more about that. And really, I just wanted to say thank you very much. To stay up to date with us at the ILC-UK, do visit our website at ilc.org.uk, and stay up to date with ILC Europe, do visit ilc-europe.org. And without further ado, I'd like to conclude this webinar and say thank you everyone for joining today. So have a great afternoon, and we shall all see you hopefully very soon at another event. Thanks, everybody.
Thank you.
Thank you.
Thank you. Bye-bye.
Bye-bye, everyone. Be well.
Bye-bye.
Bye-bye. Be well.
Thank you and bye.